Assalamu alaikum, everyone. Peace be upon you, and welcome. And thank you very much to join us tonight for this program. As I would like to introduce myself, of course, I'm Dr. Usman, another volunteer at ICN Free Clinic and a community physician.
Next slide.
So basically, as Dr. Atif mentioned, the purpose of this presentation is to talk about this situation, this condition that has gripped us for the last few days so badly that we are experiencing a frenzy of irrational things and behavior in our community and the community at large. There has been a tremendous amount of anxiety and fear and concerns regarding this virus. And a lot of that is because of fear of unknown, as was alluded before. Psychologists basically mention why an irrational fear occurs in human beings is because they have a desire of knowledge, understanding, and certainty. They want to understand about any process, why is it happening, and they want some sort of certainty. They don't like the uncertain situations. And they also have a desire of control and safety. Once they are provided with once these two desires are fulfilled, accomplished, the fear subsides, or at least become rational. And that's what we are trying to do here tonight. We, by no means, are trying to downplay the intensity of this situation. There is no doubt that this has been a pandemic. In last several decades, we haven't seen this. But we still have to accomplish those two targets that I mentioned. Understanding, having the knowledge, having some certainty, and having control and sense of security. So we plan to present some scientific data that we know so far. And as a believing community, a faith-based community, I would also present a perspective that as a believer, how are we supposed to react in such situations to attain those two factors. So as I mentioned, in our faith teaches us in every situation how we are supposed to react in any condition. And I have just quoted here one of the verse from Holy Quran in chapter 9, verse 51, which can be translated as, say that any calamity that befalls us is nothing but what Allah or the Almighty God has decreed. And He is our sustainer, and upon Him the believers trust. It gives us a strength, as I said, the desire of having control and security, that we believe that our God, our protector, is with us, and He will control the situation and provide us the security. And then we have a supplication that we can recite to gain that sense of security that our Prophet has taught us in such situation. Bismillahil lazi la yadurru ma'asmihi shay'un fil ardi wa la fis sama'i wa huwa as-sami'ul alim. Meaning that there is nothing in the earth or in the heavens that can harm us without Allah's permission, and He is the one who listens and knows everything. So that was just I just wanted to touch upon as a believer, because if we do not behave as a believer, it's not demanded of us. Moving on to the next slide. Okay, so just wanted to share some basic facts about the virus. The coronavirus is basically, it's not a new virus. It's a very old virus. Actually, the virus was initially discovered in 1960. And it belongs to a big family of viruses called corona. And there are several strains that have been discovered from this family. And some of them I will mention later on, but the virus that we're talking about is SARS-CoV-2 is the scientific or medical name, severe acute respiratory syndrome, coronavirus 2. And it's called virus 2 because virus 1 was actually diagnosed and first discovered in 2002, which caused an epidemic of SARS. And then, as I mentioned, this whole family of viruses was diagnosed in 1960, and it has been present and has caused infections in human beings, most commonly causing common cold that everyone gets sick with. It is also coronavirus, caused by one of the coronavirus. It also has caused SARS, which was a severe illness that was first diagnosed in 2002 and 3. Then in 2006, we had another strain of virus from this family which caused Middle Eastern respiratory syndrome, MERS, and then now we have COVID-19. So these three strains have caused a significant morbidity or illness in human beings, but there are several others which have called mild illnesses, and we don't talk about that. So there is a chart that just basically tells you how this virus is transmitted to the man. So as I mentioned, there are several other strains that I am not mentioning here. I'm just depicting here only 3 viruses that have caused very severe illnesses in human beings. And we have found that the source or the host of this virus is the bat. The virus is carried by the bat, and somehow it gets transmitted to the human being, and when it happens, it causes severe illness. So in 2002, this virus from the host transmitted to human beings through an intermediate host, which was a civet cat, and that resulted in severe acute respiratory syndrome. In 2006, another strain, MERS, was transmitted from the host bat through the camel, which was the intermediate host, to the human being again, resulting in Middle Eastern respiratory syndrome, which was also a very fatal illness. And now, in 2019, December, we had coronavirus, CoV-2, which is causing COVID-19 disease. We do not know what's the intermediate host. We do not know at this point what caused the transmission from the bat to the human being. This is the current status of the coronavirus in the United States. This is a tracker that is actively being updated on a daily basis. And as you can see, there are total 1,268 confirmed cases of coronavirus in the US. And these are the states that have that have patients which died with this infection. And the most badly hit state is Washington. As you can see, the biggest circle here in the Washington. The next slide would focus on the Illinois.
I think we have to turn the light off for clear picture.
So in our state of Illinois, basically so far there are confirmed, actually this is not updated slide, but the confirmed cases are 42 now, with 0 deaths and 2 patients have recovered. With this, you can calculate the mortality of this virus, which is roughly around between 2 and 3% at this point. Next slide. So at this table, what we are trying to tell you is that, as I mentioned in the beginning, trying to allay some anxiety that is prevailing high. So you need to know where COVID-19 virus stands when it is compared with other coronaviruses infections that have happened in the past. So as I mentioned, SARS, which actually I treated myself in 2002, I was a resident, and we had patients of SARS in our hospital. That had a mortality of about a little bit higher than 10%. And MERS, which appeared in 2006, had a significantly higher mortality at 36%. COVID-19, on the other hand, has a mortality of about 3% at this point, 1.5 to 3%, depending on the age. Yes, it is spreading very fast compared to MERS and SARS, and that's what's making this virus very horrific and very scary. But the reason for that is that it's easy transmissibility. Longer incubation period of the virus allows asymptomatic patients to transmit this virus to others before they get sick, and that's why the virus is spreading much more fast at a faster pace compared to MERS and SARS. But you can see that we had a swine flu or bird flu with a 60% mortality. We have Ebola with 50%, and we had in 2018 we had a H1N1 flu. So we have been through these infections in the past, and we have dealt with those. And with the proper precautions, we can deal with this situation again one more time. But we need to put the things in the right perspective. The other thing you need to know is that everybody just thinks that COVID-19 is going to cause death in everyone. That is not the case. You have to see what is the result, what is the spectrum of the illness. If you do get infected, almost 81% patients have a mild flu-like symptoms, which passes in 1 to 2 weeks, and you just need to stay at home. Severe hospitalization is up to 14%, and only 4.7 or up to 5% is resulting in critical illness, which requires ICU stay or maybe ventilation. So majority of patients who are getting sick are going to recover. So, and what are the patients who are getting critically ill? Those are patients who are elderly. As you can see, the highest mortality rate is in 80+ age people. So the mortality significantly increases after age 60. It is not fatal in the infants at all, 0% mortality, and a very low level illness in children to middle-aged people. So one thing to understand and reassure you, everyone, that the illness is present, but it is not going to cause death in everyone. So what are those people who are having this more severe illness? As we said, age is one factor, and then having pre-existing So having pre-existing condition is a significant factor in causing critical illness. If you are already sick with a cardiovascular disease,
Wrong with the PowerPoint here. All right.
is it good?
Yeah.
So if you already have a cardiovascular disease, diabetes, any respiratory illness, cancer, anything that makes you immunocompromised would significantly increase the chances of a critical illness and increase the chances of death. However, people who have no existing condition, you can see here that the mortality rate is very low in such patients.
Next slide.
Next slide. So this was the basically current scientific knowledge, fact-based knowledge that we have so far about the current status of coronavirus. I hope some of these facts has helped you to allay the anxiety. We also need to understand to cope better. As I said, we do need to take necessary precautions. And in order to take the necessary precautions, we have to understand what we can do, why the virus is spreading. So this, before I mention transmission from the host to human, this is a person-to-person transmission, which is called community transmission. That is unfortunately happening in the United States now. So there are cases being diagnosed or detected at this point who have not traveled to China or any other international travel, and they have not been exposed to anybody who traveled, but they are being diagnosed with the infection. And how is that happening, or why is that happening? Coronavirus has a droplet transmission. What is droplet transmission? Is basically when you cough or sneeze, the virus is in the droplet spray, the spray that comes out of your mouth, and based on the virus size and the weight, they are going to deposit, and the coronavirus is going to deposit within a radius of 6 feet. As you can see, some of the bugs here, bacteria and viruses, as TB, measles, and other viruses, these are airborne. And airborne means you can transmit through air current. This, so far, we know that this is being transmitted through the droplet, which means it is deposited on the surface, and then it can stay on those surfaces up to 2 to 24 hours, depending on what kind of surface is that. And if someone touches that surface and then touches their eye, nose, mouth, they can transmit the infection to themselves. So that is called fomite transmission. Next slide. Okay, so the common signs and symptoms if you get infected, as I mentioned, the latent phase of this virus is 2 to 14 days, meaning you can start showing the symptoms within 2 days up to 14 days. And this is the asymptomatic time period when you can transmit the infection to others. Common symptoms and signs that are mentioned in patients are fever of 100.4 degree Fahrenheit, dry cough, shortness of breath, malaise or weakness, and less common abdominal pain, vomiting, and diarrhea. So this was a background of the virus, what we know about and what we can do. I'm going to invite Dr. Atif again